How to prevent groin pain from cycling. However, cycling can cause different kinds of groin pain, which can be very uncomfortable and force you off your bike. In extreme cases, it may require surgery. Like with the most common cycling pain, groin pain when cycling goes away through a mix of stretching, mobility exercises, and adjusting your road or mountain bike fit. We'll describe the symptoms and causes of cycling groin pain. Then we'll explain how to treat and prevent it. If the pain doesn't get better when cycling or continues when you get off your bike, please see a doctor. What is the groin pain? Cyclists often feel hip-related groin pain in the inner thigh muscles called the adductors. The groin is where the abdomen joins the thigh on both sides of the pubic bone. We'll describe the symptoms and causes of cycling groin pain. Don't confuse them with the outer thigh muscles called the abductors. What causes cycling groin pain? Hip arthritis, a torn labrum in the hip joint, or extra bone growth on the thigh bone or hip socket can reduce hip mobility. This can cause hip pain when cycling. It can also pull on the adductors during the pedal stroke, causing discomfort and twinges on the inner thigh. The second common cycling groin pain is soft tissue irritation, says bike fitter Bianca Broadbent. Problems with saddle length, width, or position can bother soft tissue in the groin area. This includes chafing in the crease between the buttocks, saddle sores, or numbness in the crotch. Male and female groin pain. Because women tend to be more flexible, they're less likely to have hip-related groin pain. But she adds that soft tissue groin pain can be similar in men and women. For example, fluid-filled cysts on the crotch or sit bones can form in both sexes. Male and female anatomy differences mean cycling can cause different genital pain. But doctors don't classify this as groin pain. How to stop groin pain while cycling. 1. Bike fit and position. If limited hip mobility causes inner thigh pain, Broadbent suggests shorter cranks. Pedaling shorter cranks moves your hip through a smaller range, reducing hip joint compression and inner thigh friction. Raising your handlebars opens your hip angle, potentially relieving tight hip pressure. But doctors don't classify this as groin pain. Make sure your saddle isn't too far back or handlebars too far forward, which can cause you to slip onto the tender crotch area. Incorrect saddle height can lead to groin pain because setting it too low or high increases crotch pressure, Broadbent says. If your inner thigh rubs painfully on the saddle when pedaling, your feet may be too close together. If so, widen your stance by moving your cleats further out on your cycling shoes. 2. Loosen your hips. Hip mobility exercises might help if the pain is hip-related, but not for everyone. If bone growth in the hip joint from arthritis or impingement is the issue, stretching can irritate the surrounding soft tissue, Broadbent cautions. Don't force stretching if it makes things worse. If cycling hip pain prevents riding, seeing a physical therapist or sports medicine doctor. They may recommend an injection or surgery to remove the bone obstruction. 3. Riding technique. Avoid pulling up too much when pedaling if you have irritable hips because this uses the hip flexors. Pushing down uses bigger muscles and is more efficient and hip-friendly. Stand up often to relieve crotch pressure, advises Dr. Seth Rankin. Shift forward and back to prevent prolonged pressure on one area. Former British cycling bike fitter Phil Burt agrees. He suggests getting out of the saddle every 5–10 minutes, especially on indoor bikes. 4. Find the right saddle. Measuring sit bone width is a starting point for choosing a saddle, say Burt and Broadbent. But Burt notes this isn't perfect, as you only sit on your sit bones when very upright. In a lower riding position, weight rests more forward on the ischial rami, Broadbent explains. So a wide saddle may not be best, even with wide sit bones. Her sit bones indicate a 168mm saddle, but she rides a 155mm one since she rests mid-saddle. One trend is measuring where the saddle first reaches 80mm wide, thought to be the average rami width. If you sit further forward, the 80mm point should be closer to the nose. Further back if you sit rearwards. The popular specialized power saddle is wide mid-saddle, suiting riders who rest weight forward of their sit bones. So saddle shape matters, broad bent stresses. An incorrectly flared saddle can pressure sensitive tissue. Use the same saddle style on all bikes, advises Burt. Saddle length also depends on riding style. But others like moving back and forth on a longer saddle to shift pressure points, Broadbent explains. Center cutouts, often on women's saddles, can relieve genital pressure and enable pelvic tilt to open the hips, reducing hip impingement, she says. 5. Saddle angle. Bike fitters recommend a level to the slightly downward saddle. Opening the hips is important for hip-sensitive riders, Broadbent says. Most weight should be on the sit bones with minimal crotch pressure, agree experts like Sirota and Retool. If symptoms only occur when riding, pressure mapping like Gebiomized can pinpoint uneven pressure, Broadbent suggests. But if you notice lumps, get them checked, she adds. Expensive saddles are often lighter but not more comfortable. 6. Keep it clean and cool. Change immediately after riding. Wash shorts before re-wearing and don't remove groin hair. Chamois cream may help. Long indoor trainer rides can aggravate pain, warns Burt. A fan on your crotch keeps things cool and dry to prevent skin breakdown.